High blood pressure, or hypertension, is often called the silent or invisible killer. Do you know why? Because most people feel absolutely normal even when their blood pressure is dangerously high. There are usually no obvious symptoms, no pain, no warning signs, yet inside the body, the heart and blood vessels are quietly under constant strain. It's like water flowing through a garden hose at too much pressure. The hose may look fine on the outside, but inside, tiny cracks and wear are forming. Over time, this constant pressure can damage vital organs. The heart has to pump harder, which thickens its muscle walls and can eventually lead to heart failure. The kidneys, which act as natural filters for the blood, can become scarred and lose their ability to clean waste from the body. High pressure in blood vessels in the brain increases the risk of stroke, while in the eyes, it can harm the delicate vessels that supply the retina, leading to vision problems. Can you see why doctors warn that hypertension silently shortens lives, even if you feel healthy on the outside? Monitoring blood pressure is simple and one of the best defenses against this hidden threat. At home, people often use automatic digital cuffs that measure the pressure with just the push of a button. Doctors recommend checking it regularly, especially if you are over 40, have a family history of hypertension, or live with risk factors such as stress, obesity, or high salt intake. Do you know what your blood pressure was the last time you checked? Many people don't. And that's why it's important to treat it as seriously as checking your weight or vision. Avoiding hypertension often comes down to daily habits, reducing salt intake, eating more fruits and vegetables, staying physically active, and managing stress are all powerful tools. Even small steps, like walking 30 minutes a day or cutting back on processed foods, can lower blood pressure. Another less-known fact is that sleep plays a major role. People who sleep less than 6 hours a night are much more likely to develop high blood pressure. Isn't it interesting how something as natural as good sleep can protect your arteries as much as medicine? So while hypertension may be invisible, it is far from harmless. It quietly damages organs over time, but with awareness, regular monitoring, and healthy habits, it can be controlled and even prevented. The big question is, will people take it seriously before it causes harm, or only after a scare like a stroke or heart attack? What do you think motivates people more? Fear of disease, or hope of staying strong and healthy longer? High blood pressure, or hypertension, is often called the invisible killer because it usually has no clear symptoms until serious damage occurs. The pressure exerted by blood on arterial walls gradually weakens them over time. Unlike infections or injuries, hypertension progresses silently, without pain or visible warning signs. Many people only discover it after complications such as heart attack, stroke, or kidney disease. This silent progression makes it one of the most dangerous chronic conditions. Early detection through monitoring is the only way to catch it before harm is done. Example: someone can live for years with blood pressure at 160/100 mHg and feel fine, until they suddenly experience a stroke. Analogy: it is like a small leak in a dam, unseen from the outside but steadily eroding the structure until it suddenly breaks. Arteries are elastic tubes designed to handle normal fluctuations of blood flow. Chronic hypertension forces them to endure persistently high stress. This stress causes microscopic tears in the vessel lining, which attract cholesterol and form plaques. Over time, arteries become stiff and narrowed, limiting oxygen delivery to organs. Damaged vessels also increase the risk of clots, which can block blood flow completely. This vascular damage is the root of many hypertension diseases. Example: narrowed coronary arteries from long-term high blood pressure can cause angina or heart attacks. Analogy: it is like overinflating a garden hose. Eventually, the constant pressure weakens the walls, causing cracks and blockages. The heart must pump harder to overcome elevated arterial resistance. This leads to thickening of the heart muscle, particularly the left ventricle, a condition called left ventricular hypertrophy. While initially an adaptation, the thickened muscle eventually weakens, leading to heart failure. The risk of arrhythmias, such as atrial fibrillation, also increases. Hypertension is one of the strongest risk factors for heart attacks. Plus, persistent high pressure puts the heart under relentless strain. Example: patients with uncontrolled hypertension are twice as likely to develop heart failure compared to those with normal pressure. Analogy: it is like making a car engine constantly run uphill. Eventually, the motor overheats and wears out. Hypertension increases the likelihood of both ischemic and hemorrhagic strokes. Narrowed arteries reduce blood flow, while weakened vessels are more prone to rupture. Chronic high pressure also contributes to cognitive decline and dementia by damaging small vessels in the brain. Silent mini-strokes, or microbleeds, may accumulate over years, affecting memory and thinking. Hypertension is therefore a leading cause of preventable brain injury worldwide. Protecting brain health requires strict control of blood pressure. Example: about 50% of stroke cases worldwide are directly linked to high blood pressure. Analogy: it is like repeatedly hitting fragile glass with gentle taps. It eventually cracks and shatters, even without a big blow. The kidneys filter waste from the blood through delicate capillaries. High pressure damages these capillaries, reducing filtration efficiency. Over time, hypertension leads to scarring of kidney tissue, a condition known as nephrosclerosis. This can progress to chronic kidney disease and even kidney failure. Because kidneys also help regulate blood pressure, a vicious cycle develops where damaged kidneys worsen hypertension. Monitoring kidney health is essential in long-term hypertensive patients. Example: many dialysis patients developed kidney failure, originally due to uncontrolled high blood pressure. Analogy: it is like using a fine sieve with water at too high pressure. The mesh tears and can no longer filter properly. The retina in the eye relies on tiny, fragile vessels for blood supply. Hypertension damages these vessels, causing a condition called hypertensive retinopathy. This leads to blurred vision, bleeding, or even blindness in severe cases. Chronic high blood pressure can also increase the risk of glaucoma and macular degeneration. Eye examinations sometimes reveal early signs of hypertension before other symptoms appear. Protecting vision is one more reason to control blood pressure. Example: ophthalmologists can detect hypertensive retinopathy in patients who did not know they had high blood pressure. Analogy: it is like overpressurizing the sprinklers in a garden. The delicate nozzles break and water no longer flows evenly. Blood pressure is measured in millimeters of mercury, MEMs, and expressed as systolic over diastolic, e.g. 120/80. Regular monitoring is essential, since readings can vary during the day. Home blood pressure monitors provide valuable insights between doctor visits. Ambulatory monitors that track pressure over 24 hours are especially useful to detect hidden hypertension. Early diagnosis depends on consistent tracking rather than one-off measurements. Accurate monitoring guides lifestyle and medical interventions. Example: a person whose blood pressure spikes only at night can be diagnosed using 24-hour ambulatory monitoring. Analogy: monitoring blood pressure is like checking a car's tire pressure regularly. Small imbalances, if ignored, lead to blowouts later. Preventing hypertension requires lifestyle adjustments that reduce vascular strain. A diet low in salt and high in fruits, vegetables, and whole grains lowers blood pressure. Regular physical activity strengthens the heart and improves circulation. Avoiding smoking and excessive alcohol protects blood vessels. Stress reduction techniques such as meditation or yoga also help regulate pressure. These non-medical interventions are powerful tools for prevention. Example: the dash dietary approaches to stop hypertension, diet, has been proven to reduce blood pressure significantly. Analogy: it is like maintaining a house by fixing leaks early. Small lifestyle changes prevent major structural damage later. When lifestyle changes are not enough, medications such as diuretics, ACE inhibitors, beta blockers, or calcium channel blockers are prescribed. These drugs lower blood pressure by reducing fluid volume, dilating vessels, or decreasing heart workload. Treatment must be tailored to each patient, often requiring a combination of drugs. Regular follow-up is essential to ensure control and avoid complications. With proper management, patients with hypertension can live long, healthy lives. The key is adherence and consistent monitoring. Example: a patient with a blood pressure of 180/110 mHg may need 2 or 3 medications plus lifestyle changes to achieve control. Analogy: medical treatment is like using brakes, gears, and steering together to control a speeding car. You need all tools working in balance.